So hello everyone. Happy Sunday. It's so good to be here with all of you as usual. And I have a very special guest here, Dr. Stephen Juriga. He is one of our local veterinary dental specialists, and he has a huge fan club. If you guys have read any of the comments on the post that I made to announce live that we're doing today, you will see that he is very loved and people really enjoy working with you. It's really quite amazing and heartwarming to see that. So hi everyone. I'm hoping that everyone can hear us. Let me just make sure I can see the comments here as well as they come in. So Dr. Juriga, tell us a little bit, how you got into dentistry and also where you're located and, your practice name, etc.
Well, thank you for the invitation, Dr. Suter. It's an honor to share some pearls of oral health with pet owners and whatnot. I owned a general practice in Oswego, Illinois for 15 years, and then was fortunate enough to go back to the University of Illinois to do a dental residency over a 4-year period instead of over a 2-year period. Got board certified in 2007, and that's all I've been doing since then. We're now fortunate to have, we have 2 residents and 3 boarded dentists in Aurora, Illinois, not so far from your practice. And we do referral veterinary dentistry and oral surgery for the Chicago region, Indiana, Iowa, southern Wisconsin. And then as we were talking before about the zoo, we're fortunate to provide services to Shed Aquarium and Brookfield Zoo on the side.
Wow, that's awesome. What animals have you done dentals on?
Just about everything. We have 2 wolves and a Serval cat on Friday. And then 2 weeks ago, we did a 14-year-old tiger. So,
okay.
Marine mammals, there's not a lot. Sea otters and sea lions and seals at the aquarium. But the zoo, we're pretty regular visitor because of the bears, and there's just a lot of tooth fractures that we have to manage.
Okay. Well, that's interesting.
Yeah, it is
That's interesting. Yeah. So I guess, a quick side question. What about anesthesia? Because they're so different. Do you get like a zoo veterinarian that comes with them or something, or you just...
Brookfield's one of those unbelievable institutions. So they're a leader in imaging for zoos all over the world. But they have a board certified anesthesiologist on staff. And so they have, I believe, 4 or 5 boarded zoo veterinarians that provide anesthesia and healthcare for all those species. It's absolutely amazing. So those patients are anesthetized before we see them. They're trained. The lions and tigers will actually present their paw for an injection of anesthetic instead of being darted.
Wow.
And then they receive the same anesthetic that our pets would receive, which is the same anesthetic that we would receive. So monitoring fluids, gas anesthesia. It's just a matter of workflow, where we do the procedure and how quickly they recover. We're actually transitioning to doing procedures at their enclosure rather than transporting them to the hospital. And that saves 40 minutes of transfer and 40 minutes of recovery. So it's kind of evolving as we go.
Yeah, and by hospital, you mean your clinic or their own
Our clinic will do
clinic?
the non-lethal small pets or small animals, but no, they have a hospital on the premises with an OR, full CT, ultrasound imaging, everything. But to get an animal from tropic world, sedated an ape, and get them to the hospital, from sedation to the hospital is about 45 minutes. And then hospital back to tropic world asleep to recovery is another 45 minutes. So we're trying to shorten those procedures by doing procedures in each one of the animals, exhibits.
Yeah,
so
yeah.
It's evolving.
That's amazing. That's amazing. I guess, when we talk about dentals, the word dental doesn't really actually describe what you're doing. So what name or what do you call what you're doing?
Oh, no, that's great. I'm glad that you define that. So we've used the term or the acronym COHAT, COHAT being a comprehensive oral health exam and treatment. And basically, a dental is an examination under anesthesia that includes probing and imaging, that would be dental radiographs, to diagnose any or all disease that's present. And then we formulate a treatment plan, and then we act on that plan and provide that care. So veterinarians, unlike human dentists, do everything in one setting. Once we have probed and examined and imaged, as you know from practice, then we know whether there's fractured teeth, teeth that need to be extracted, teeth that need bone grafts. Occasionally we contact owners, but many times they don't understand the process, so they've empowered us to make those decisions. So we photo document every step of the procedure so we can make the best decisions for their pets with anesthetic time in consideration.
Yeah, yeah. Because oftentimes, we say dental cleaning, but it goes far beyond that, of course. It's not that they're just getting a cleaning. They're really getting like a full mouth exam, and that includes, you mentioned or no, that was someone else, but you also look for tumors and things like that, right?
Oh, you bet. So there's very few patients that receive a routine dental prophylaxis or cleaning, where it's cleaning and polishing, and we find no disease. It's interesting. We'll reappoint animals after a big dental procedure with many extractions a year later, and those pet parents that have been maintaining oral health, or those animals that genetically aren't super prone to periodontal disease, we will do a few of those routine cleanings. But pet owners need to realize that we are likely to find in over 90% of our patients something that needs to be treated. And if that is root planing, if that is periodontal surgery where we're treating a pocket, great. If that's extractions, dogs and cats don't chew their food. Those teeth are infected and painful. They need to allow us to provide those extractions, and then we'll provide them the images and the tools to keep the rest of their teeth healthy. And then we'll move together as a team, really positioning. In our practice, we try to position our referring veterinarians as the gatekeepers of annual oral exams and monitoring their health, and then using us whenever they need us as an extension of their practice.
Yeah. And so what are some of the most common diseases or dental issues that you see, and when does it start really? Because, I see quite a few patients, newer ones that come for whatever reason that have never had a dental or like an oral, a COHAT. So.
No, that is a great question. So I think the American Veterinary Dental College says, 70% of animals after the age of 3 have periodontal disease. So if I have a new puppy or a dog and I'm in general practice, I am going to recommend and suggest at the animal's 1-year annual physical exam that at 2, they should be thinking about doing the pet's first dental procedure. We may want to start earlier in our toy breeds that are prone to periodontal disease and bone loss. We may look at my golden retriever at age 2 or 3 and have beautiful teeth, no broken teeth, no gingivitis, no visible disease. But as you were saying, or we'll generalize or maybe repeat over and over, as pet owners, but surely as veterinarians, we always underestimate the disease until we can probe and until we can image those mouths. So, figure by age 2 or 3. I love that the fact that you mentioned the top 3, because we just trained 50 veterinarians in Rockford last week. And we emphasize that really periodontal disease, which would be bone loss, tooth fractures occur in 24% of our patients, and cats have a disease called tooth resorptive lesions, which are like cavity-like lesions that we don't know the cause. We cannot prevent it, but that occurs in 20 to 60% of cats by age 5. So I'd say 50% of cats by age 5 have 1 or more tooth resorptive lesions. So veterinarians that do good oral exams like yourself will look for focal gingivitis, fractured or worn teeth, or just really in our smaller breed dogs, plaque or calculus touching the gum line, because that's when things are going to start to happen depending on the genetics of that patient. Lastly, I know that wraps into, as pet owners, what can we watch for? And there are few clinical signs or symptoms that you'll ever notice. I mean, stinky breath, and they all eat. They're all happy or seem to be happy. So I think, really, they're fortunate if they're here with us today that they have a veterinarian that they're going to go ahead and depend on some feedback from their oral exam on their annual basis. And then they have to learn to act on that.
Right, right. Because I remember a dog, he was actually a small dog, not a Jack Russell, a Yorkshire Terrier. He had one loose incisor and no tartar, no gum issues that I could see. I mean, the perfect mouth otherwise. Well, he went in for his dental, extraction, and he had 11 teeth that needed to be pulled. And there was no way, I mean, I couldn't see it, and I'm sure you have plenty of these stories.
I had Holly last week. We joked that you don't want to pull a Gracie. And then Tiffany. Tiffany's a Maltese. Mom's great. Michelle's great. Brushes twice a day. Teeth were pearly white. Had really bad breath at age 4. And she lost all of her cheek teeth. She had 75% bone loss on all of her cheek teeth, even though mom was providing excellent home care. And that was the genetics of Tiffany being a unique Maltese that was prone to that disease. You couldn't have predicted that. So, there's something that we can do as far as oral hygiene, but there's also going to be genetics that factor into things that we can't control. So I have lots of those stories.
Yeah. Michelle is actually here and she says, hi.
Oh, Michelle Cole. Oh, she's the best.
She's so excited for this. Still brushing my girl's teeth every day. We've gone to Dr. Juriga from everything to braces for Holly for a severe overbite to a bone graft for Tiffany and so on. And
so Tiffany was at bone graft, and Tiffany's photos are on our iPads in the room, so that when we now, hi Michelle, when we now get a King Charles Spaniel, a Maltese, or a Papillon, and we see maybe a little bit of gum recession, we pull out Tiffany's pictures, because they're likely not to have a Tiffany-like event, but they need to understand that dental radiographs or x-rays are going to drive our decisions on what's best for their pet. So that's cute.
Yeah, and imaging is so important. Just recently I had a German Shepherd who has a broken canine tooth at the bottom, and it's been broken for a while, and I kept telling the owner, you really need to get a dental, but finances were a little bit of a challenge. So she went to her veterinarian and they did a dental, but they didn't take it. And I'm still really upset about this because the reason I sent her is I wanted to know if this dog has pain, if this tooth is causing him problems, because he's a little high strung and always whining. And I'm like, what if this dog has pain? So maybe you could talk a little bit about the imaging as well, and also the special type of imaging that you do.
Oh, so imaging is huge. So we see teeth that are fractured, as you mentioned, that have pulp exposure, will all become infected in 2 to 6 months. And they should receive an extraction or root canal therapy. There's just no, let's wait and see. Teeth that are fractured superficially that have not exposed to pulp, recent studies said 24% of those teeth are infected. So that's why they need an x-ray, like you made that referral. Discolored teeth, gray, purple, or pink, that have had some concussive trauma to it, 50% of those teeth become diseased over a pet's lifetime. So when you're confronted with tooth trauma, the only way we can effectively evaluate those patients is by probing the tooth surface under anesthesia. So if it is exposed, they're not painful. And then dental radiographs, not skull, or dental x-rays, not skull x-rays. Dental x-rays are very good at showing bone loss between teeth, and in larger or more severe infections of the bone. We also compare the healthy tooth. Dogs and cats have 2 of everything. So like in your Shepherd, we would be comparing the pulp chamber size of the normal looking tooth to the pulp chamber size of the abnormal looking tooth. And we did that for or I did that for 13 years of my career. We're fortunate now in referral dentistry to need and afford cone beam CT. So cone beam CT allows us in 20 seconds to do a full head scan and create three-dimensional pictures and multiplanar evaluations of all the teeth and the bones of the face for jaw fractures and oral tumors. My colleagues in Colorado were like, dude, we use this machine every day. And I thought, oh my God, you guys must be so busy. And they said, no, no, no. We do it at a discount. Ours is an 80% discount for all of our dachshunds and our shepherds and our whatevers that come in. So three-dimensionally on our multi-rooted teeth in the back of the mouth, we don't miss anything.
Mhm.
So for your pet owners and your following, I think dental x-rays is a standard of care for their veterinarian to provide a good dental procedure.
Mhm.
And then for those facial swellings, oral tumors, animals that are maybe high risk or have a lot of disease, if they consider a veterinary dentist in their region, and we can give them their website, and maybe I'll do that now, www.avdc, that's American Veterinary Dental College.org, and they can find a diplomat in their region. Probably 75% of us now have CT as part of our regular workup. Lastly, maybe that the dog hasn't had a first dentistry at 10, goes to a diplomat, and the next dentistry is done at your practice or somebody else's practice if they've ruled out any big bad diseases.
Right.
So that's kind of how we've leveraged our imaging.
Mhm. And you always do both?
We do both. So our pediatric cases, our cats under a year, our puppies under a year, for puppies get malocclusions and we need to extract or move teeth that are hitting them in the roof of the mouth. They don't need a cone beam CT. But the 3, 5, 7, and 10-year-old that presents with just a teeth cleaning and maybe they have some missing teeth or they have some receding gums, or it's a healthy looking mouth, but we're expecting some extractions, we do a cone beam CT on every patient at an 80% discount. So in our practice, I think we can talk about fees a little bit, can't
Mhm.
we?
Yeah,
We have
yeah.
say a $430 imaging fee, and that's full mouth x-rays and cone beam CT for the teeth cleaning patients or the routine patients.
Mhm.
So they get a discounted CT hidden on top of their dental x-rays so that we can look at then in their nasal cavity, we can look at their TMJs, their temporomandibular joints. We typically catch their middle ears. So all the bones of the face, the nasal cavity, all the teeth in 3 dimensions allow us to not miss anything.
Mhm.
Lastly, we calculated that in patients that have bone loss, we probably miss bone loss in about 10% of our patients without CT. So by
Mhm.
using CT, it's just our way of making sure that we have checked all the boxes and we miss nothing.
Mhm. And so, since the CT is like a full mouth X-ray, what's the benefit to then have dental X-rays on top of that? I mean,
That's
I'm
great.
assuming you're seeing different things because otherwise people are like, well, why do I need both, right?
Right. So, I think what we find is that CT is excellent at evaluating everything but the incisors. So there is talks of us going to CT with just occlusal images of the upper and lower incisors because
Mhm.
we can see everything else. Um, uh, and then we build the case with full mouth x-rays too, because we share those x-rays with our referring partners or our referring veterinarians. And right now, I'd say almost 50% of veterinarians have dental x-rays.
Mhm.
So if they're going to be following up a patient and doing next year's dentistry, if they have a question on a radiograph from 2 years ago, we can create a radiograph out of the CT, but having that baseline set of images so they can reference those, I think is still useful. So we've been doing both digital radiography, standard CT for you and I, or a dog that receives contrast and a CT of, say, their chest is like 10 chest x-rays in terms of radiation.
Mhm.
Cone beam CT is the equivalent of one chest X-ray,
Mhm.
and a full mouth dental series is the equivalent of an eighth of a chest X-ray. So
Mhm.
dental X-rays are really, really digital, low
Mhm.
radiation.
Mhm.
Cone beam, again, in the big picture of things, quite low radiation, and
Mhm.
an efficient 20-second scan adds 4 minutes to the procedure.
Mhm.
So that's how we positioned ourselves, and we reserve standard CT with contrast for unique oral tumors behind the eye, in the back of the jaw that may involve the salivary glands and the lymph nodes, where margin assessment needs to be done at a university level or a
Mhm.
specialty
Mhm.
center level.
Mhm. Yeah. Yeah. I mean, I always say that the more information we have, the better we can take care of the animal, and give them the best life possible that way.
I
We
know in
can.
some of your patients, we are retrospectively sending CTs to you and you're doing a little research on that. So being
Mhm.
able to see that transition. So it's invaluable in our practice. I could never practice without it. But my son is in vet school. My brother's a veterinarian. I have two nieces that are veterinarians, and they
Oh,
all
wow.
work at practices with dental x-rays,
Mhm.
and they're going to do excellent care with dental x-rays. So I think, that's going to be the standard of care: safe anesthesia, dental x-rays,
Mhm.
make and diagnose good decisions,
Mhm.
but realize that we're available in everybody's market to provide advanced imaging for not just jaw fractures and oral tumors. A dog presents with a snotty nose or a chronically snotty nose. Is it a tooth? Is it a tumor? Is it a fungal infection? If it's not a tooth, we'll biopsy it and figure out whether it's a tumor or a fungal infection. It's nice to be able to have that imaging to support you on that workup.
Mhm. Yeah, yeah. That's really amazing. And so, there are a few questions that come up about pricing, because we started talking about that, and everybody is still talking about what's a reasonable price for a cleaning. But again, I just want to remind everyone, if you weren't here in the beginning, we're talking about a whole lot more than a cleaning. So feline or feline, oral health assessment and treatment. So it's a lot more than just a cleaning. And that's just really important to remember. And so that's why also there's a huge variation in how much it ends up costing, right?
Right. So yeah, I think that is a really good point. So I think very few of the people that are listening today could take one of their pets into a dental procedure, into a procedure, and have cleaning, polishing, imaging, anesthesia, nursing care and recovery, knowing that there's a nurse monitoring anesthesia during the time, and not find any disease. I've talked to colleagues in our Chicago suburban region, and I get a feeling that it's going to range between, say, $700 and $800 for cleaning, polishing, full mouth x-rays, um, and nursing care, as well as that short day's worth of hospitalization. I think in the city, it can be twice that much. For us, I think we're probably $1,200 to $1,400, but then it incrementally will increase, and it's never an intent to run up a bill. But if we find, say, the typical Maltese, because Michelle's there, the typical 7-year-old Maltese that comes in will have 6 or 8 teeth that have bone loss. So that patient will receive local nerve blocks to numb the area. So those patients are kept under a lighter plane of anesthesia. They'll receive surgical extractions, which means we'll elevate a flap, section teeth and remove the teeth, and we'll suture that closed so it heals over a couple days, not over a couple weeks. They'll receive post-extraction x-rays, post-operative pain medicine, maybe antibiotics. So I think that 7-year-old Maltese very easily could be the $1,200 to $1,800 patient. And that's just something people need to budget for. And people need to understand that the veterinarian is going to make those decisions under anesthesia, hopefully show you pictures afterwards, so that we're not stuck on the phone discussing care or waking the patient up and then people not coming back. And then you have to pay for anesthesia twice. So that's very rough talk about uh, dental procedures. We have patients that, are $2,000 to $4,200 doing full mouth extractions. It depends on what age and what condition they come to us in. But I think they should be thinking about, those first fees that we said, the $600 to $900 plus whatever care they need, maybe double that. And what's your preventative plan moving forward so you don't have to do that every couple years?
Yeah. And thanks for sharing that. And I think that brings me kind of to the point where, what questions do we need to actually ask the veterinarian who is potentially going to do the dental to really find someone who's going to do all the things that need to be done? Because what I find is that people go out and they call different clinics and they ask, well, how much do you charge for a dental? And they say, well, $400. The next day is $1,200. And then they go for the cheaper one, which I know financial considerations play a role, but what do we need to really ask? Because the $400 dentistry is not going to be as good as the $1,200. I mean, there's no way.
Right. So we have $1,200 dentistries in the city that don't have dental x-rays, and it's just because they can charge that. So, one of the reference points, whether you post it or whatnot, I think our website, veterinarydentalcenter.com, is really easy to navigate, to understand. There's at least 20 simple oral conditions. They're called oral conditions that you can read about, and they have pictures, and they give you bullet points of what you need to know. So it's kind of nice reference. It has the steps, the keys to safe anesthesia, so that you can read about that. So I think, ultimately you're looking at a dental procedure. You're looking for them to provide a dental procedure in a designated space that includes full mouth dental radiographs, not we take spotted dental radiographs, because at your dentist, we get a cleaning, polishing, they probe around our teeth and record it on a dental chart, and then they take dental x-rays every 2 years. Of course, we get cleanings in between. So I think that's what people should be asking for when they look at their veterinarian. Cats have tooth resorptive lesions. Half of them do. If they have a tooth resorptive lesion, in order to extract that tooth or perform crown amputation, you need an x-ray. If you have one tooth resorptive lesion, they're likely to have more. You need dental x-rays because many of those lesions are underneath the gums. Excuse me. So that standard of care for feline dentistry has been there for a long time, and dogs the same. Excuse me. I think you had asked a question about the dental procedure from start to finish.
Yeah.
Let me clear my throat, and then maybe you can start by fasting and blood.
Yeah. So because I'm really impressed when I looked at your website and everything that you offer and how you go about it. I was really impressed because you really include the pet owner to such a big extent, and you focus so much on making them feel comfortable as well. So maybe you can talk a little bit about, how do you start? Well, you have your first consultation, and kind of take it from there, from start to finish, because that will also answer a lot of questions regarding what you should be asking your veterinarians. So for you listeners here, make note of that, because it will then give you some points to ask for, because what you're providing is good care, right? It's like standard of care that every animal should have. And certainly you have like special training in dentistry and so on that probably most veterinarians don't have, at least definitely not to that degree. But the care that's happening in the process needs to be at that level, in my opinion, anyway.
Right. I think not to spend too much time on our practice, because this is an educational thing, but I appreciate those kind words. We were gifted with the fact that my wife and I had a vision of designing a practice that you walk into that's like your home. And if your pet falls asleep on a couch after their exam, that would be our goal. So it reduces the stress of the whole procedure. And I have colleagues in dentistry all over the United States that have different versions of what their dental experience is. And everybody approaches it differently. So we're a really warm and fuzzy and low stress type of environment. And I think that'd be a great standard for people to aspire to. In my general practice, we couldn't do that as easily. We did have some exam rooms with couches in it that made it a little bit easier, but I think the dental experience is really a great question. It starts, so people should understand like what does an animal go through on that dental day? Because I know we're talking about lots of things. You need dental x-rays. You need a doctor that's able to go ahead and provide extraction therapy as needed. You maybe need a doctor that's willing to refer to somebody in your region if the pet is a higher risk anesthetic patient, or if it is going to be a big procedure where there may be many extractions and they won't be able to complete that. So that would be you trying to feel out your veterinarian's staffing and equipment and skill level. And those are all tough questions. I don't really have a brochure for that.
Yeah,
And then
one example, the dog with a canine tooth, because it's a lower canine tooth, most of the tooth root actually creates stability of the jaw, and it's easy to break a jaw, right? So asking about the skill, well, do you feel comfortable extracting blah, 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 and how would you do that, so that they can explain the process a little bit, because that way you can also feel out whether they know what they may
right.
be.
So we get a lot of people that doctors will say, well, I really don't want to extract that tooth because I'm afraid of breaking the jaw. So you should go to see us. And other doctors will be like, I really don't want to extract that tooth. I think we'll watch it. And then pet owners will find us. So we spend a lot of times educating veterinarians on, if that's a procedure you want to do, you can come to one of our wet labs and we'll train you on it. If that is a procedure that you don't feel comfortable with it, then you owe it to the pet owner to refer that patient, because inevitably the pet will have discomfort and we don't want that to happen. So, but you're right. It'd be great if the owners knew the anatomy of that tooth and they could quiz their veterinarian, but they don't. So it would be one of those things where, I think maybe pet owners could ask their veterinarian, well, what does Sally's or Tiffany's or Holly's oral exam look like? Do you see any broken teeth? Do you see any inflamed gums? Just trying to get them to focus in on their concerns, because we're not trying to do annual exams on every patient in the Chicagoland market. The reason we send pre and post cleaning pictures and images back to every veterinarian, you've received our reports, is because we want you to see what we found. So when you see another patient with that disease, you're on top of it. Or when that patient comes back next year, you can use those photos as a reference to monitor that patient moving forward. I think a brief mention of start to finish, kind of like expect animals to be fasted for anywhere from 6 to 12 hours before the procedure. If your pet has special needs to eat in the morning, they can maybe be scheduled later in the day. If they cannot be fasted, they can be scheduled first of the day. If your pet is anxious or you're anxious, can you be scheduled first of the day and be actually with the pet during their pre-medication? And then they move into surgery, they move into recovery, and they can be released earlier in the day. Is your veterinarian willing to accommodate that? I don't want to step on my brother's or my niece's toes and say, hey, guess what? Everybody wants to be your first patient of the day. But I think you should be open to that, because there are anxious dogs and cats or owners, and we should accommodate them. And then they should have pre-anesthetic blood testing. You had asked about solutions when we were talking about, high-risk patients. Patients that have heart murmurs, they need chest x-rays or they need an echocardiogram. They can safely be anesthetized. Patients that have chronic renal disease or kidney disease, They just need to be stabilized, as you have done, on diets and supplements and maybe fluid therapy. And once their kidney disease is stable, then we can do the dentistry to provide an improvement in their oral health. Patients are then always given a pre-medication. They're anesthetized, they're intubated, and they're monitored by a nurse during the whole procedure. They're on IV fluids. They're on a multi-parameter monitor, just like you and I would be on: blood pressure, carbon dioxide, EKG. They're kept temperature for sure. They're kept toasty warm. There's no reason that a patient in dentistry should ever leave the dental room or the dental procedure cold. And if those patients are under a light plane of anesthetic and they've been monitored closely and they've been kept warm, I'm glad you mentioned that, monitoring warmth, but we're just nuts about keeping them warm. They wake up over 2 to 3 minutes, and they go out for a walk 15 or 20 minutes later. So it's really those are the keys to safe anesthesia. So then those patients typically are released 2 or 3 hours after the procedure, with appropriate pain medicine and whatnot. So that's jumping around, but that's a snapshot of what happens. Really, when a patient comes in from their admission through their pre-medication until they're anesthetized, they're touched on and off for 30 or 40 minutes. The procedure takes an hour, hour and a half or two. And then post-operative monitoring and everything, nurses are touching them for another hour. So there's a lot of things that are going on during that 4-hour, pre and procedure and post-operative care thing. And then, every hospital prioritizes dentistry is different. Is it scheduled as a surgery patient? Is there a nurse assigned to the patient? And are they monitored under anesthesia and monitored in the recovery phase of it? I would like to say yes. But that's a lot for a pet owner to try to quiz. But, if they use maybe our website or our discussion as maybe their standards of care. I know Michelle's on there, but Michelle would be one of those people that would probably be like, tell me what dental x-ray, how you take dental x-rays and how you're going to keep them warm and who's going to monitor my pet, during the procedure and after the procedure. And those would be good, well-informed questions and would open up a conversation. And if that conversation's short and not insightful, maybe they should ask again. Otherwise, I'd expect if people asked any of my nieces and nephews, and as I joke around, then they would have well, this is how we do it at our practice. And it'd be a great educational tool. Maybe they'll walk them back past dentistry or into dentistry as they're being escorted out of the practice so they can see what the facility looks like or what a patient under anesthesia looks like. That's not a big ask. We have viewing windows into our operatories, which are kind of unique. But if we didn't have viewing windows, I'd walk them by dentistry, live or not live, and let them look at the equipment. Let them be comfortable. So that's a great question.
Yeah, yeah. So basically, it's your animal, and you have the right to ask all the questions so that you can feel comfortable. So if you ever have someone make you uncomfortable about asking questions, it may not be the right place. And certainly sometimes they may be overwhelmed with work at that day and have too much going on and don't have the time to talk to you. But just keep asking. And you can also send an email and have bullet points of questions so that it's easy for the vet or the vet tech to answer these questions that you have, because you deserve to really know what you're getting, because this is your animal and things have to be done right, although there's very little generally very little issues with anesthesia, at least with more of the modern approach to things. We're not in the Stone Ages anymore. But yeah, you just want to be comfortable with all of that and really know what your animal is going to be going through.
That's a great segue. I think that asking an email, asking those questions, we get interviewed all the time by clients, or asking for a tour, asking insightful questions, emailing your veterinarian, asking for a tour of the dental room. I think they should embrace that.
Mhm. Yeah,
Veterinarians should.
yeah. And if they don't have enough time, they can just create a video and then they can send everybody the video.
You
I mean,
bet.
that would be the
You
other
bet.
reason instead of having to repeat things over and over again. So that's certainly an option as well. Um, I guess, we're obviously talking about really good oral care, but I know a lot of people are afraid of it and maybe kind of postponing it. But what does that do potentially to an animal? Um, Obviously, we talked about pain, but
Right.
what are some of the other effects, not just locally, but also systemically of poor dental health, basically?
Yeah, I think pain is the biggest thing. And the most common sign of pain that we see in our patients is that our small breed patients, or maybe large breed patients, will act old and sedentary. So after a dental procedure where we relieve their discomfort by extractions or biopsy or remove a tumor, and they feel 5 years younger, they go for longer walks. They greet you at the door with their favorite toy that they haven't picked up in 6 months. Those are stories we hear all the time. Um, so I think improving their comfort is what our goal is. My colleague in South Carolina, Sharon's like, I just don't want my patients suffering in silence. So, it's kind of like, you don't want to badger people into it, but that's what they are doing. They're not going to miss a meal. They're not going to drop food out of their mouth. They're not going to shift food in their mouth. Really, very few things are painful enough for you as a pet owner to realize it and bring it to your veterinarian. Systemically, yes, we know it's well documented in people that infections in the oral cavity or inflammation in the oral cavity will result in heart disease, kidney disease, a COPD, a respiratory disease, strokes, just rheumatoid arthritis. The list goes on and on. Documented studies in veterinary medicine show liver, heart, and chronic kidney disease at a higher incidence in animals that have untreated periodontal disease. So healthy mouth, healthy pet. And then people need to just realize that it's more painful living with those teeth than it is for us to have a patient under anesthesia with long-acting nerve blocks that we administer before we do anything painful. So when they wake up, they're numb. And as those nerve blocks wear off, their other pain medications kick in. Those patients feel a lot less pain long-term if we can just diagnose and treat that disease. And then nobody's been able to prove animals live longer, but it's assumed that, we do increase the longevity of a pet's life. Truly, we improve the quality of their life by maintaining an oral healthy mouth.
Yeah, because I mean, it's like having a toothache that's continuing and you still have to live, you still have to go about working and all of that, but you have this constant pain going on for years. I mean, that's not something that anyone would wish on an animal, of course. And since they still do all the things that they would sort of normally do, and sometimes the decline of becoming more sedentary is subtle and slow, and so you may not think that they have a tooth issue. So that's why I am so adamant that my patients or my clients get regular dental care, and every time they come into my office, even if it's like on a monthly basis to get their chiro, I will look in their mouth because I want to see, has anything changed since then. And I also recommend that my clients look into their animal's mouth once a day to really see, and be it while they're brushing or whatever, or if the animal yawns, have a quick look and be familiar with what the teeth are supposed to look like. If you have to take a picture, look at some pictures online to see what teeth should look like, what the normal anatomy is, do that, because you're the one who's going to see it. Because if you're getting a dental and the next day your dog breaks a tooth and you don't get another, COHATs for another year, your dog is going to have pain or your cat is going to have pain for that entire year. So make sure that, as soon as you get a new puppy, you start fiddling with their mouth so that they will let you look at things and touch it and do all of that. So that's kind of your job as a pet parent, is to to be, familiar with that. And of course, there are some dogs that will not let you do that, or cats. For those who do, it's really important to have a look, because, they can bump into something and have a fractured tooth, and that's very painful.
No, that's good. Yeah. Anytime then you can condition them to accept, whether it's cleaning their ears, trimming their nails, wiping their teeth with gauze wrapped around your finger or a toothbrush. You now have a cooperative patient that allows you to do an exam, or allows the veterinarian to do an exam when they go into your office.
Right.
And that's a win-win for everybody.
Yeah. Before we head into maybe more of the home dental care in between, I wanted to chat a little bit about antibiotics and ask you what the research has shown as far as need, effectiveness, when to use it and when not to use it for within that process.
Yeah, that's a good question. So we don't use antibiotics to treat any disease as a primary tool. So if an animal presents to us with a facial swelling or an abscess, we will put them on antibiotics until we can get them in for an urgent dental procedure. There is no benefit in using antibiotics preoperatively in patients other than those patients that are immunocompromised, which are few, maybe our diabetics and maybe our animals that are chemotherapy. But even our animals in heart disease, most of the cardiologists have now dropped the preoperative antibiotic requirement. If your dog has really bad teeth and we're worried about a bacterial shower into their bloodstream during their cleaning, they get a bacterial shower every time they eat. So there's really no benefit in using preoperative antibiotics at that time. We just need to treat that mouth. And we reserve our antibiotic therapy for those animals that have a chronic bone infection or maybe a chronic nasal infection, and now we've removed the tooth and closed the site, the communication between the oral cavity and the nasal cavity. And then we might use a week's worth of antibiotics for those severe bone infections or nasal infections. Lastly, the mouth is such a vascular and well, is such high immunity and whatnot that if you remove the dead bone or the dead tooth or treat the pocket, which was a melting pot for all of that to go on, it heals in spite of antibiotics. So it's really a matter of committing to the procedure that your pet needs, because antibiotics are something that probably should be termed as used occasionally post-operatively.
Yeah, thanks for that, because I have read about this as well. And the thing is that most veterinarians, that are not specialists in dentistry, they will just automatically add antibiotics with the IV before they actually start the cleaning and the procedures. And so that's something that you would have to ask and also request, and you may have to say that multiple times so that it really goes in, because generally as humans, we are animals of habit. So we do things habitually. And so if you have a veterinarian or, who will habitually use antibiotics preoperatively, the veterinary technicians, they already have that ready to go, and it may just be done just because that's what they always do. So you may have to just be really clear and repetitive about it so that your animals don't get the antibiotics, because antibiotics, as you know, have an effect on the microbiome. And we talked about the oral microbiome as well with Holly Gans a few weeks ago. So if you want to learn more about the oral microbiome and how that affects everything, you can go back to watching that. It's also on my YouTube channel, but it's also here on Facebook. But in any case, it's really important that if you're asking something that your vet is doing habitually, you just may have to say it multiple times. Maybe even write it on a shirt that you put on your animal, or whatever it is. If there's something you don't want done, you have to be really clear about it so that everybody knows, because that will give you the best chance to then get what you wanted.
And we have veterinarians that's probably the most commonly asked question. Veterinarians are increasing they're improving their standards in dentistry. And they may be talking about doing full mouth x-rays, and they may be talking about protocols of anesthesia or antibiotics. So they'll ask us, do you use antibiotics? Why do you not use them and whatnot? Because I think they're trying to set the protocol and aim towards best medicine. But once we look retrospectively at the literature in humans, that's where all the literature is, that there's just really not a benefit in preoperative antibiotics in those patients. So therefore, let's not use something that we don't need. So we get that question often.
Yeah. All right. Okay. So I think the next question I would like to ask you is about, home care. What do you recommend, once they've had a good oral health assessment and treatment, what do you recommend?
So we recommend mechanical plaque removal. So plaque is the white gummy stuff that develops on teeth after every meal or after a cleaning. It mineralizes into hard white stuff in 4 or 5 days and turns into hard yellow stuff in a month. So it goes from clean teeth to teeth covered in plaque to mineralized plaque to tartar. That's the progression in dogs and cats. That's a progression in graduate students. If you ever go to a human dentist lecture, here's a bunch of graduate students, don't brush your teeth. Let's see what happens. So it's kind of cute. So a plaque is a biofilm and it needs to be mechanically removed. So therefore a toothbrush, or we recommend moist gauze with nothing on it. If you want to add a veterinary approved toothpaste or OxyFresh or just a variety of different gels or whatever, if none of those exert any beneficial effect enzymatically or antiseptically. And if your pet behaves better with something that's flavored, great. If it doesn't behave better, I think then that flavored or that enzymatic toothpaste is counterproductive in you trying to disrupt the white gummy stuff on the outside of the upper and lower teeth. The inside of the teeth are cleaned with their tongue. And that's why we're nuts about pre-cleaning photographs, because that gives you the roadmap of where the tartar is going to come back. So if you can use those pre-cleaning photographs to target your home care, you're going to be more successful in a moving patient or a small patient. Second to that, we recommend a larger kibble diet. For my integrative or holistic patients that are on raw diets, they don't benefit from that diet because it's made by Hills or Royal Canin, but it's a large kibble that's made with interlocking fibers, and it's much like biting an apple. So it has an abrasive wiping effect on the tooth surface. And then not a lot of anything else works, because chemical plaque dissolving of a biofilm, in my mind or in my research, is not effective, even though another website, Veterinary Oral Health Council, so it's www.vohc.org. So the VOHC seal of approval, there is a water additive or two, there's a toothpaste gel or two that have 6 to 9 weeks worth of efficacy. But I think when you just look at the dynamics and what's published in human literature, you and I need to use a toothbrush with or without Crest toothpaste and floss in order to manage the plaque on our teeth. And that's what we recommend for our patients.
I really like that you're saying that, because that's been kind of my spiel too. It's like,
good.
you don't need toothpaste. You just need to brush, because it's the mechanical part that disrupts things. And so I'm glad you're saying that, because that's the most common question I ask. And people, it's like they can't wrap their head around not needing a toothpaste because we're kind of trained or brainwashed into thinking if we don't have that little white thing with stripes on the toothbrush, like nice big, so that you really have a mouthful of it, which is disgusting in my opinion. But hey, so I'm really glad that you're saying that it's really good. I also have seen some of these rubbery sort of chew things where you can add some food to it, and then it has more of an abrasive action because of how the tooth kind of gets into it. I think it has some ribs, that kind of.
None of those toys have made it through the clinical testing for Veterinary Oral Health Council. And again, I don't know how and I don't want to squash those people, how those water additives and I don't even think there's any rinses that have worked. So it's the kibble design is unique because in the exam room, I will drive my car keys right through the kibble. So you kind of wonder about, I had a Burmese mountain dog, couple of them, the shooties, and they fed their dogs flossies, which were these curly tendons. And I think in the process of chewing on some sort of, you don't know where those are sourced when you say raw hides or compressed raw hides or whatnot. I'm not a big greenies fan, Dentistix fan, but research says that the greenies and Dentistix clean the upper fourth premolar, not the 22 or 42 teeth that they have. So you have to have something like an apple, something like some sort of compressed treat that they chew on that kind of fissures and wipes their teeth but does not break. An antler is too hard. We mentioned in our conversations before this meeting, the fingernail test is really important. So you don't want to feed them. We're big advocates of no nyla bones, no antlers, no real bones. Or if you go the real bone route, because a lot of holistic doctors do, then we want to go with bigger bones. So they just can't get those downward biting forces to fracture teeth. But yeah, it becomes one of those things where there's just not a lot of food products. And if you think about like traditional kibble diets, they swallow whole or the kibble shatter. There's no benefit in feeding a kibbled diet to a dog in teeth cleansing. And I don't know, are your patients on a raw diet?
Yeah, generally they're on the raw diet because, I also find that the more inflamed the body is because they're getting a highly processed diet that causes more inflammation, that then also produces more inflammation in the mouth. So I find that obviously we have issues in the mouth that can cause damage, but we can also have other systemic issues that can cause more inflammation in the mouth. And I mean, that's what my dentist always says, that, the mouth is a window of what's going on in the body, but vice versa, obviously, as well. Whatever's happening in the mouth is going to affect the body. So I still prefer like a more natural diet that way. But, if we look, I'm a big fan of looking at what the animal is getting in the wild. So a dog or a cat will never chew on a cow, most likely, because they're not chasing down cows. They're chasing down rabbits, maybe some bird, some chickens or whatever, smaller prey. And so if they chew on a bone from a smaller prey, there's still meat around it. So when they chew on it, the force, some of the forces are being taken up by the meat or whatever the other tendons and other tissues are. So they still get a little bit of the benefit, but it's not like pushing right on a bone where there's nothing there in between that can kind of dampen the forces a little bit. And also they're obviously softer. So if you wanted to use food, in my opinion, for dental health, obviously a low inflammatory diet to begin with, and then something that is more mimicking of what's happening in nature, because in nature they don't usually just run across bones. I mean, certainly if it's possible, but they're going to look for something that has some meat to it, because bones are not very, very calorie dense. They're not their optimal food in that regard. They want they need the whole thing.
Right. And I know that, in the past, we've tried chicken necks and turkey necks. We even hypothesized semi-frozen turkey necks and chicken necks. Would they be, somewhat abrasive? And in a small subset of patients that wasn't well studied, just feedback from the parents, I don't know that that helped. But there seemed to be like, that's kind of a natural thing. There's meat, there's bones, it's not cooked. If it's semi-frozen, is it a little more abrasive? I don't know. But we're pet owners. We have domesticated animals. I mentioned we'll be at the zoo treating wolves for broken teeth, but they have moderate amounts of plaque and tartar, and they're fed I'm sure they're fed a wild source of food because they're not in enclosures.
Mhm.
So in the wild, those patients are going to have plaque and calculus on their teeth. Natural selection has probably selected those patients to live longer. They're probably not, if they're prone to developing bone loss and tooth loss, they don't reproduce as long.
Mhm.
As pet owners, we need to provide that home care, like you said. The
Mhm.
basics are mechanical plaque removal, starting when they're young. Or
Mhm.
what we do is we start at their consultation and say, hey, we think you're going to need preventative care. Let's do touch your teeth reward for the next 2 or 3 weeks before your dental procedure, so that when we send you home with pearly whites, you now have a cooperative patient that's already been conditioned to having fingers in their mouth.
Mhm.
And then hopefully it's a win-win instead of giving them all that information when they're going home with maybe a painful mouth post-extractions,
Mhm. Yeah, yeah,
um,
yeah.
whenever we can coach them up.
Yeah, yeah. And it's really important, as with everything, prevention is worth a pound of cure, and we need to do that if we want to have healthy animals. And since we have taken them out of nature, we have to provide them with what
Yeah.
they need. So we have to make up for that. Um, all right. So I think I kind of covered everything, but I guess one more thing. What's the oldest dog or cat that you've ever done a dental on?
Well, I don't oldest. Well, just last month, so in April, we had a 19-year-old dog and a 20-year-old cat. So I've been echoing those to some, I have a 15-year-old dog that comes in with, a early heart murmur, but the heart isn't enlarged, and they're like, but he's so old. So I've been just, I can't remember the dog's name. Um, so I think cats probably 20 or 21 years old, and then dogs, the 19-year-olds stick out in your mind. But age is not a risk factor with anesthesia. It is their overall health status. So if they've been well cared for and well worked up ahead of time, and if they have chronic disease, and it's heart disease and kidney disease are the big two, um, but, we also see if people know what Addison's is or Cushing's is, hormonal diseases. We have anesthetic protocols, just like when my wife goes in for a procedure and she has Addison's, the anesthesiologist has a protocol for her. So if your patient is older, um, if they have pre-existing conditions, then sometimes it's a matter of, does your veterinarian feel comfortable, or can you recommend somebody that can provide that anesthesia, either under a board certified anesthesiologist, or like in our practice, our nurses and our doctors and our residents have all trained in advanced anesthesia. So we have a team of people that monitor our patients so that we can provide safer outcomes for the higher risk patients or shorter procedures.
Mhm. Yeah, and that's why I like using, dental specialists like yourself, because you have, obviously you're really amazing with the dental aspect of things, but you have advanced training in anesthesia, but then you also have an advanced training in pain management.
Right.
And I think those are really the three things that are crucial for success, basically,
Right.
and for, long-term health in the end.
And I think that's good that you mentioned that, because our big concerns with our patients are tooth loss. Dogs and cats do fine without teeth, especially if they're diseased.
Mm.
The pain that they'll encounter during the procedure, that's a no-brainer, because they're on morphine before the procedure. They receive local nerve blocks before we do anything painful. So they're on super light twilight levels of anesthesia.
Mm.
In fact, when we roll them from one side to the other side, we have to watch carefully that they don't wake up. They
Mhm.
wake up and they're numb, and then we administer pain medicine in the postoperative. So we've got tooth loss pain and then anesthesia. So if you're pet owners, from our conversation or visiting our website, reading the keys to safe anesthesia as their little template, if they can ask those probing questions, then we've overcome the fears that people have, but many times aren't addressed during their consultation or their annual exam. So a doctor wholeheartedly says, your pet has some gingivitis. We really need to do a dental procedure. Well, people are not going to act on that if they don't understand what a dental procedure is, and we haven't overcome some of their fears. And if we've set the seed, or they can ask a question, well, I'm concerned about tooth loss, or I'm concerned about anesthesia, open up that conversation. ultimately more care is going to be delivered, not at our practice, but where it needs to be delivered. So maybe our educated pet owner base now knows what to ask to overcome whatever their fears are,
Yeah,
because we've
yeah.
got that managed in veterinary medicine. Most of us do. So
Mhm.
it's a matter of that our clients ask all the time. So we just preemptively give them that whole spiel. I'm
Mhm.
gifted, lastly, we have 50-minute exams. We have an educational period of time that we can make a big difference. When you have an annual exam for 20 or 30 minutes and you need to talk about whatever, vaccine titers, about joint health and about nutrition, and oh, by the way, you have bad teeth, you really have little bits of time. We're much more fortunate that we can sit down and have a conversation.
Mhm. Yeah, yeah, and that's really amazing that you have that time and that you also have these resources on your website. I appreciate that. And the thing
Sure.
is too that as pet parents, I think it's really important too that when your vet says something, just make a mental note or write it down and then do a little research when you get home. Because the thing that I've noticed is when people come in with their animals, they're so focused on their animals, they're a little stressed out. And so, I may say a lot of things but maybe 10% gets retained, and that's completely normal.
Right.
Because with our animals, we kind of get more into the heart, and so it's like the connection with the brain is different.
Right.
And so when you get home, then you can really get your brain back into gear and do some reading. So that's really important. So maybe bring a piece of paper when you go to the vet or a little notepad or something, and then just write the things down that they say, and then you can go home and do a little research. And I think that's in general really important. No matter what, if they want your dog or cat to have some kind of drug, write down the name, go home, do a little research so that you're actually informed about it and you can make an informed decision and then go back to the vet and ask more questions if you have any questions. Obviously, unless your dog is about to die and needs something right then and there, that would be not
Right.
the time to start writing down and go home to do some research. But, in general, I think it's you have to help your vets as well because, again, there's sometimes limited time. They don't know all the questions that you have, so just help your vets by doing a little bit of the research and then coming back with questions and things like that. I think that's really important to be a team rather than thinking that your vet knows everything and you just do what the vet says.
No, I agree. That sounds great. We're
Yeah,
always available as a profession to follow up with questions. Every practice is.
exactly, exactly. So thank you so much. I
Oh,
know
you're
there
welcome.
were some more questions, but I think we've covered a lot of things. And when we talked a little bit earlier, I mean, we did talk about anesthesia-free dentistry and how that has its limitation. And I mentioned that in general, it's a little bit more in the natural holistic medicine field that people tend to go more for anesthesia-free dentistry. But I just want to emphasize that holistic does not necessarily mean all natural. Holistic means you're addressing the entire body in the best way possible for that particular individual at that moment in time. And anesthesia-free dentistry can really miss a lot. And so we want to make sure that we really do it holistically because sometimes it does require a little bit of drugs. So that's definitely not the worst thing. It's worse than to have, diseased teeth, a diseased mouth long term. So anyways, on that note, anything else that you wanted to share before we
No, I think I like how you frame that because I think anesthetic-free dentistry is something that if you can't effectively probe or image the mouth, there's so much that we're going to miss. So I think advocating for those patients to receive a comprehensive oral health assessment, the COHAT test that we use. And if people feel that anesthetic-free dentistry has a niche, is that something that you do cosmetically between pre-planned dental procedures, but it'll never replace a dental procedure. It'd be a false sense of security. We owe our pets more than that to be thorough. and not miss anything. So it's great that you brought that up and framed that so that people understand the differences between the two. But we had a few notes and everything, but no, I think we've covered everything, you know. Let's just improve our pets' overall comfort and quality of life and overall health by making oral health a priority or a conversation that pet owners have with their veterinarian every year. If that could be it, you know, if you just have a conversation, what do their teeth look like? Is there anything that you're concerned about as they're looking at all the other organ systems? That'd be a win-win for the pet.
Yeah, and I think the mouth is a determining factor for overall health. Let's just say if there's something wrong in the mouth, the entire body cannot be healthy. And I've had that from my own experience. I've had a root canal tooth that was majorly infected. I had no idea that that was happening because there were no nerves. And removing that tooth made a world of difference. I got my life back. So if there is something going on in the mouth, there's a limitation of how healthy the rest of the body can be. So that's how important it is. And you guys who are listening, you know, I always talk about gut, and gut being the root, you know, of all, or the cause of all disease, or that's where disease starts. But don't forget that the mouth is a part of the digestive tract. And so if the top part or the front part of the digestive tract is not healthy, nothing else can be. So that's how important it is. And that's why I'm so passionate about dental and oral health, because of my own experience that way. And it can make a world of difference for your animals. So make sure that you pay particular attention to that. And I will be talking to or interviewing an anesthesiologist as well, because I know there's a lot of fear around that, and you know what the newer techniques and things are to manage that, and also what the reality really is, because I know everybody has a friend who had a dog or a cat who died with anesthesia, and so there's a lot of fear going on. So I want to address those fears as well, and then talk with one of my other colleagues about more of a holistic approach to overall health and dental health that way. And then I will also be interviewing my dentist from New York, Dr. Garatola, because he's going to shed some light on in the human field as well, and it will be eye-opening. I can tell you that. But anyway, so that's kind of in the plans, but you were such a big piece in that puzzle, and I'm so glad that we're so aligned in so many ways. With what you do, and I love what you do. I love how you care for the animals, how you care for the people, for the pet parents, and how you do the very best. I mean, your passion and your love for what you do, and for your animal patients and for people, it just shines through. And I'm so grateful that you're around, and I'm grateful you're in my area.
No, it's nice to share cases with you.
Yeah. So thank you so much for being.
Oh, you're welcome.
And spending your Sunday morning with us here. And
no, that is great. Great opportunity, great conversation. I think we touched everything. Yeah,
definitely. And thank you all of that, you out there. And I know there have been some questions and I couldn't quite keep up while also listening to Dr. Juriga. So I will go through all of your message comments a little bit later and see if there's anything else that needs to be answered that we didn't cover. But thank you all for being here. And again, thanks to you, Dr. Juriga, and have a wonderful weekend, everyone.
You too. Thank you.
Bye-bye.